Hey guys, this is Dr. Shivam, and for those who don't know me, I am an aspiring ENT and head neck surgeon, author of 2 PGME books which are dedicated for you to clear your exam and blah blah blah. But what is needed, what is the main thing regarding you is that I give a lot of value through my channel. My main aim is to make you clear the exam and achieve your dream branch, dream subject, whatever you are dreaming to get in the PGME examinations. So I am dedicated to you. Last year also many of your seniors have been helped by my YouTube channel, and I feel grateful for all the love and comments they have given to me, and because of them I get the energy to make more and more videos, to put on more and more efforts. Now what I have come up, or what we have seen, is that the recent NEETPG exams conducted by NBE, the DNB exam conducted by same board, the AIIMS examination, the PGI examination. So among them, the AIIMS and NEETPG have sort of similar things. That is, they want to ask some of the topics which are repeated in most of the exams. Those topics are called high yielding stuffs, which I was giving you through my YouTube channel. My whole aim was to give you a funder to get a smart study, study for less hours and get maximum output out of it. So if you get those high yielding stuffs before your exams, what happens is you get around 80 to 100 question, and sometimes 120 to 140 question from beforehand. You need not to give efforts, so those questions are fixed for you. You will be getting those in your exams on sure basis, and as you have already revised it many times through videos. What the benefit you get by videos, I am not talking about the long videos which are an hour or 2 hours long, because no one can put concentration over 1 hour, which I have been seeing many apps where they have put so lots of videos of 1 hour, 2 hour, 3 hours. What is this? No one can study for this long hour, and I don't think it's humanly possible to cover every subject by seeing this video. The gold standard is you attend the live classes, but if it is not possible, then you take the notes, attend some satellite class or T&D courses, and watch some high yielding stuff. Short videos are very useful for you. Short videos, high yielding stuffs which I have been giving you are very useful. They have been proven to be very useful, because 10-15 minute short videos, you can put your concentration and the retention power is too much. And if I give you my efforts to put you the topics by finding the topics and give you only the relevant stuffs, it is just a gold for you to clear your exams. So I have been teaching, I will be teaching you, guiding you for this year also. But the thing is, I find, and the many of my viewers have commented and asked for a paid course. That is, they want some personalized guidance. So what benefit you will be getting? So I have made a paid course, which is, the cost is just irrelevant to the value I am giving you via that course. So it will contain more than 70 short videos of high yielding stuffs, and all the videos which will be coming for this year. So that course, what you will be getting from that course, I will be telling you. You will be getting all the high yielding videos, all the high yielding videos which I will be making for this year, for your next year NEETPG examination, mid DNB exams, PGI exams, as well as all the content which I have already designed, which now most of the people won't be able to access. But this year, from those videos, there were a lot of questions. I can show you the proof also. People after giving the exam lot of people have come to my platform and commented about these videos were so much useful. The voice were resonating in their mind when they were giving the exam. Okay, so something very important and something very useful. I only attempt to, or I only intend to provide you with value and all the needed motivation which is needed for you to clear your exams. So you can see, I don't know whether you can read it or not. It's going to be hard, but hard doesn't mean that it's impossible. Yes, your PGME exams is going to be very hard. This phase of studying in some remote city away from your home is going to be very tough, but it is worth it. It is hard, but it is not impossible. You will achieve that. But the only thing needed is you have to give your 100%. All the efforts, everything, all the distractions, subtract them, all the effort, add them. Because whatever you are getting, realize that whatever you are getting in your life, you are responsible for that. So you are the only responsible person for whatever you are going to get in your life. So invest in yourself, invest in getting the value. So that course I have fixed it for initially only 50% because I want the quality to be maintained. You will be getting the course via email. You can watch them in your mobile anywhere and anytime. Means I will want your 20 minutes from each day to give to those video, and you will really you will feel the difference what it makes in your preparation and the marks you are going to get in PGME examination. So reading those extra high yielding stuffs and revising them whenever you get free will fetch you a lot of extra marks and confidence, which most of the people lose in the final last 15 days because they cannot revise. They think a lot of things are there to revise. Now what all to revise? So the high yielding stuffs video which I will be providing you will be giving you the needed confidence, because confidence is something which is very much needed at the final crucial moment of the last 15 days of your exam. AIIMS is coming. Now this confidence will help you to reduce your mistake and correct some extra questions. So maintain your confidence. Whatever you have read, have confidence in them. And how you can get the confidence? By revision and by doing the smart study which I'll be giving you. So today also we'll be learning something, like, because I always intend to give you value. So we'll be learning something in this video which is the surgery portion of your last recent NBE pattern NEETPG examinations. Okay, so I would suggest you to enroll in that paid course which will cost you 2000 rupees for this year, which will have all the recent videos for this year which I'll be making for you to make lot of questions right in your coming NEETPG and mid DNB exams, along with those videos which have already been proved to be very useful for your examinations like AIIMS and NEETPG, along with the guidance. I'll be guiding you a guidance call where I will frame your study schedule, how you should study, the way, the flow in which you will go, and the motivation what all is needed, because I want you to achieve your dreams. There is one quote: either modify your dreams or magnify your skills. So I want you to magnify your skills, get these values, and you will surely get whatever you are wanting for. This course is nothing. If you calculate, if you see the economic perspective of it, I am giving you a course of 10,000, more than it. People means in something called nothing. It's 2,000 for more than 150 courses. If you divide it, it will come 10-15 rupees per video. Calculate it, do your mathematics and invest in yourself. So we'll be starting with the NEETPG surgery question. This is Dr. Shivam Kesavani. Hope this will help you, and if you find anything, you can call me or you can contact me over WhatsApp. So friends, we will be starting with the surgery recent NBE pattern examination, where they have asked you, the first question was from an instrument. So this instrument section, can you identify this instrument? Yes, this is Morris retractor. So I have already made a video of instruments in the course. I am telling you, see, I find it a wonderful way to connect with you, to connect with some of you, because at personal level it is not possible to get connect, to have a one-to-one call with everyone whoever is there on my platform, but I would give my every effort to whoever gets connected to me by my course, and I will ensure that you will achieve whatever you are dreaming of, because it is never impossible. Only thing is that you have to make it possible by every effort, by everything whatever is needed to be done, and you will do it. I will make sure that you do it and achieve it in this year only. You don't need to give 2 years for clearing the exam and getting your dream branch. You only need to follow a particular set of pathway, the smart study, and the guidance. You need some mentor to guide you in your tough phase, and I am there for you. Even if you cannot get into my course, I am always available to you, but I would suggest you to get into the course. Although it is initially for only 50 people, I will try to manage my time and extend it so that most people can get benefit of it. So it is Morris retractor used for most of the abdominal and the gynecological surgical procedure, and other details I'll show, means you will get in my course. And what the thing is ki I am not going to means bit detail of everything, because the last question paper what you need to focus is you need to know the topics which are asking. So if they have asked you an instrument, you need to see all the instrument related to surgery, so that if the examiners goes through the previous year question to frame this year or the next year question paper, he gets that he have asked one instrument, then he will change the instrument. Most probably he will change the instrument. So if you cover all the instruments, you will be getting the marks. So they are not fools that they are going to ask the same instrument. Sometimes they do, but you have to cover everything and you have to be prepared from all the 360 degree so that you strive at your goal and get the marks. So which of the following statement is true about the suture material shown in the image? So I'll maximize it. Basically it is a suture material for catgut, suture material of catgut. So the options I'll tell you, made up of rabbit mucosa. So they are asking you, the important thing is you should always note the question. So which of the following statement is true? They are asking the true thing. So made up of rabbit submucosa, no. Made up of cat submucosa, so you see the cat gut, no, it is not cat, it is sheep, so it is also wrong. Not degraded, no, these are biodegradable, means absorbable sutures, and degraded by enzymatic degradation, yes. So basically catguts are made up of sheep submucosa or beef serosa and are digested by proteolytic enzymes in the wound. So I have also made a video, a whole lengthy video, not lengthy, but it is of around 15-20 minutes. Lengthy for me is 15-20 minutes because I know you cannot concentrate more than this. Whatever is needed for you, I give it in 15-20 minutes, and you have to watch or give your 15-20 minutes every day to me so that I can assure you achieve whatever you are dreaming of, means whatever your branch you are wanting. So one news prognostic index is based on, see, I have also missed one thing. So if you do like this, you have to concentrate over question. It is asking is not based on, here the not is the most important thing, most important than anything. Even if you know one news prognostic index, but if you omit the not, you are making it wrong. And what is our goal? To get the question right. Anyway, you have to get the question right, and it is asking not. So age, microcalcification, size, ER status. So if you know this, this is a grading. So this is another simple question ki for what is this prognostic index is for. So this is for breast carcinoma, DCIC, ductal carcinoma in situ, and based upon size, grade and age of the patient, but not on ER status. So here it is the grading. I don't think you need to read the grading in detail, so I'll move to the other question. Common cause of chronic pancreatitis. So you think it is very simple? Yes, it is simple. So chronic alcoholism worldwide, alcohol consumption is associated with chronic pancreatitis in 70% of the patient, and in detail I have made a separate videos on chronic pancreatitis covering its all pathology, medicinal and every physiology aspect of it. So following statement about keloid is true. So see, some topics like this are being repeatedly asked, and these are very basic questions. Keloid hypertrophic scars, these are something which is expected from everybody to know, and everybody knows, you should also know it, because if you make mistake in these, you will be just out of the game. So you should know everything which everybody else is knowing, plus some extra things, some high yielding stuffs to get the extra edge and the better ranks, because the better ranks will give you your choice branch. You can clear the exam, but the thing is, you should be satisfying with your branch. You are going to pursue it for your whole life, so you should be satisfied. At least you would have satisfaction that whatever you have decided, you got that. So this satisfaction also helps you to move through further in your life. So following statement about keloid is true. It contains growth factor. Extended excision is the treatment of choice. Never. It does not extend beyond the wound. No. And none of the above. So it contains growth factor. Yes. Something to know about keloid is that surgical excision is not the treatment of choice. Basically, the surgical excision leads to the repeated occurrence of these keloids, because they are very prone to, and some sites like sternum, some sites like ear lobule, these are very prone sites to have keloid formation, like this skin over the earlobe, deltoid region, pre-sternal region, upper back region. These are some of the sites where keloid occur, and basically the treatment of choice is intralesional triamcinolone injection, that is intralesional corticosteroid injection. Okay, so these rarely involute spontaneously, whereas surgical intervention lead to recurrence. And some of the basic differences between hypertrophic scar and keloid scar will help you. Which of the following layer are cut during fasciotomy? So they want you to see and to keep open your eyes while you are assisting during your internship. So what all the surgeon cuts, or whatever you cut during fasciotomy. So basically, what is fasciotomy? It is a procedure, surgical procedure, where we completely open up all the fascia envelope to relieve the tension or the pressure, commonly to treat the resulting loss of circulation due to an area of muscle tension. So fasciotomy is a limb-saving procedure which is used to treat the acute compartment syndrome. So it is very commonly done. You must have seen in your ward. So we cut the skin, subcutaneous tissue, superficial fascia, and deep fascia. Which of the following is not true regarding Crohn's syndrome? So Crohn's syndrome and chronic ileitis was one of the topic which was repeatedly asked, or many questions were asked in this NEET examination. So rectum is not involved, never, which is not true, they are asking. Okay, so rectum is not involved. Okay, yes. And continuous lesion visualized in endoscopy, non-caseating granuloma, cobblestone appearance. So yes, all of them, A, C and D, are true, but which is not true is that Crohn's lesions shows escape lesions. So continuous lesions are not the features of Crohn's disease. So basically, escape lesion are the discontinuation areas of active disease in colon and small intestine with intervening segments that appear normal. So that is why they are called escape lesion for Crohn's lesion. Do revise Crohn's and the difference between Crohn's and the other. So which is the best investigation for carcinoma head of the pancreas? So I don't want to waste any single minute of you. So that's why I'm little fast, because just knowing the question answer and little description will give you an idea. And anyway, if they are repeating, you are never going to make it wrong, because you are hearing it from me. It will be there in your mind if they ask you. So which is the best investigation for carcinoma head pancreas? So nowadays, any investigation, if you see, is if coupled with the radiological investigation. So biopsy was the most definitive, gold standard. But if you couple it with endoscopy guided or USG guided, CT guided, it becomes the best investigation. So here the option is guided biopsy. So if you do a USG guided biopsy or a CT guided biopsy, it will be best for the diagnosis of carcinoma pancreas. So abdominal mass is demonstrated in congenital hypertrophic pyloric stenosis by, so it is another one of the highlighting stuffs, the congenital hypertrophic pyloric stenosis. Now everything which I am going to tell you is very important. You can note them down in your notebook or anywhere in a small sheet and stick it in front of your study table, so that you get, whenever you are moving and whenever you are drinking water, having snacks, just read them up. It will be in your mind by repeated reading, and just a visual impression will help you to retain it for a longer time and make it go into your longer term memory. So if you see the options, best demonstrated, so best demonstration by means during feeding you can palpate the abdominal lump. So congenital hypertrophic pyloric stenosis is characteristically most demonstrated in first born male child. It is 4 times more common in males than female. The condition does not present at the birth, but most commonly seen at about 4 weeks after birth. But with more and more means strict investigations and the doctors and everybody awareness, it is now getting means more early diagnosis is getting. And what will be the presenting feature? It will be presented like vomiting, and the child vomits milk and no bile is present. Immediately after vomiting, the child is hungry, means there is no loss of appetite, and weight loss is striking. The patient, your baby becomes, the infant becomes the emaciated and dehydrated. So the diagnosis is made by a test feed. In this, the baby is fed with a bottle by nurse, mother or surgeon, and then we palpate the abdomen with the warm hand to detect the lump and observe the characteristic peristaltic wave which pass across the upper abdomen. Upper abdomen. Pathologically, what happens is we are just palpating the musculature of the pylorus adjacent to the antrum, which is grossly hypertrophied. What is the investigation of choice? A simple but important MCQ. It is the ultrasonography. No CT, no nothing, but ultrasonography is the investigation of choice. And what happens is hyperchloremic alkalosis is common, and following the diagnosis, the first concern is to correct this metabolic abnormality, and the child is rehydrated with dextrose, saline and potassium. Second question: what you will do with a patient or with an infant or baby with the hypertrophic pyloric stenosis? In the management, it will be there in AIIMS, your coming AIIMS, they will be giving one option like rehydration with dextrose, saline and potassium. So it is going to be your answer. So treatment of choice is Ramstead operation or pyloromyotomy, which is needed to be done on immediate basis or as early as possible. Early the better. So calculate the GCS of a 25-year-old head injury patient with the following parameter: confused opening eye, response to pain, localizing pain. So basically GCS scale they want to ask, and it is something which you daily practice in your internship. So very simple GCS, if you define it, I'm not going into the answer, but the thing is you should know the thing if asked in future exam. So very easy mnemonic. Right now voting is going on, election is going on, so everybody is using EVM. E for eye, V for verbal response and M for motor response. So EVM, electronic voter machine. No, eye response, verbal response and best motor response. Now how you will remember the points? Points are E 4 points, V 5 points, best motor response is 6 points. 456 EVM, 456 EVM, EVM 456. Okay, so eye opening is spontaneous, you give 4 scores. Okay, so very good. Verbal stimuli, if he responds opens his eye to verbal stimuli, 3. If to pain, you give it 2. And never if he is not opening anyway his eyes, so you are giving it 1. Okay, so likewise you are giving the scoring system. Just Google it and you will get everything. Maximum score is 15 and minimum is 3. Anything below 7 is grave. So red proto-oncogene is associated with development of medullary CA thyroid, astrocytoma, paraganglioma, Hurtey cell thyroid. So which of the following? So you should know what is red oncogene and where it is present. So this is normally expressed in the following cells, where parafollicular cells of the thyroid, parafollicular C cells of the thyroid, adrenal, medulla, parathyroid cell precursor. So this makes it that any mutation or point mutation in red extracellular domain will result into the medullary CA thyroid, adrenal and parathyroid tumor. So it was present in medullary parafollicular cells of the thyroid, so medullary thyroid carcinoma. It was present in adrenal medulla below, then it causes adrenal, and it was present in parathyroid cell precursors, so it causes parathyroid tumor. Very easy now. Anything you just correlate, imagine something in your mind, image, and you will get everything. Yeah, so you should study by correlating things so that you get it when it is needed while you are giving the exam in front of computer screen, because a lot of tension, a lot of things goes into your mind. So if you correlate things, study by correlating, by imagining things, it will be better for you to retain it for a longer time. So cutoff for surgery in abdominal aortic aneurysm in asymptomatic patient. Now this is one question which has been asked innumerable times. So this is what this is the benefit which I'll be giving you by mentoring you, so by making videos and making you see those videos. So this is greater than 5.5 centimeter is the limit. So operative repair of the aneurysm, and the limit is greater than 5.5 centimeter. So for asymptomatic aneurysm, the repair is indicated if the diameter is greater than 5.5, and for abdominal aortic aneurysm, which is expanding and associated with symptom any size, is indication for operative repair. So I think this was all, and I have been teaching you, and we were talking you with each other for a long time. I think you should now have some rest, and this is Dr. Shivam. Lots of bliss, lots of happiness, lots of motivation, and lots of confidence for you. And anything, do ping me up in WhatsApp and I'll be there for you. So this is Dr. Shivam signing off. Thank you.